Hello, hello again. Happy Wednesday. It is Dr. Blanchard giving a parenting tip of the week. So here is today's question. Remember, if you have questions, you can receive expert help. Just write into me as blanchard@innerlightnetwork.org. Okay. And make sure you subscribe as well so that you can stay up to date in receiving expert help and advice. So here's today's question. So, what are the various causes of hoarding? So apparently this is a case, someone is writing in, they have a issue with the child hoarding, leaving clothes, bowls, trash all over the room. And so this parent wants to know what are the actual causes or reasons that children actually hoard. And so I'm going to go over what the causes or what can some of the causes be. You always want to follow up with your general provider, but these are some general reasons why some children hoard. So the first reason is a child may be experiencing difficult feelings. So when we say difficult feelings, like what's that? Well, hard to process feelings, things that they're trying to figure out that is causing some type of discomfort inside of them, and they can't actually process it on their own, right? Another reason that can cause children to hoard are children who are perfectionists or who worry a lot, right? And so that worry can sometimes come out in a person's inability to group things, right? So, when you're cleaning up, you have to be able to group things and to sort things. Well, if you are under some type of mental stress, sorting and grouping becomes very hard for you. And so it all kind of just comes together on you. And so that's another reason why a child can be hoarding. Sometimes children hoard because of childhood experiences. So if they've gone through or have experienced, severe abuse, emotional abuse, sexual abuse, sometimes hoarding will surface that way. Sometimes through trauma or loss, right? And so when children experience a trauma or they experience a loss, it sometimes can cause them to hoard. The last reason is family history or habits, right? So we are creatures of habit. So if we have lived in an environment that has not always been organized, it was disorderly, we too can become that. So I hope that this information is helpful to you. I always say that the first point of contact is the child's general provider or pediatric provider. They can get the child assessed to see if the hoarding is actually happening because of a mental health concern or if it's happening because of other neurological or other medical concerns. So that's going to be your first place that you want to start in saying, hey, I'm noticing something, I'm a bit concerned. The second place that you want to start once you go to your general provider, they should be able to refer you based off of their assessment to a mental health psychologist or personnel, and or if there are other medical tests that need to be done, they can kind of lead you in that direction. Some of the best ways to deal with hoarding is therapy, right? And so, noticing that, okay, the child is struggling, this is one of the ways that they are struggling. Connecting them to a mental health therapist is the best approach or one of the best approaches. Another way through mental health that you want to make sure the professional has is CBT skills. So that's cognitive behavioral therapy skills. And this particular skill set is really good when you have a child that's struggling with hoarding. I hope that this was helpful for you. Please feel free to write in again to me as Blanchard@innerlightnetwork.org. Please subscribe to this channel, and I will see you guys next Wednesday for the next parenting tip of the week.